The next proposal is that we move patients from an entitlement mentality to an ownership mentality. And this isn't some stalking horse for me saying that I'm trying to privatize everything. That's not the case at all. What it is recognizing a basic human principle that we have a tendency as humans to take better care of things we own rather than things that we just use or borrow or rent. It's just how it works. And you can think about the case of a house or a car or anything else, something that you have an ownership stake in. If you have skin in the game, as investors like to say, then you're going to take that venture, whatever it is, more seriously. Now, imagine if we extend that same logic to our healthcare. That if I never pay a dime, if I never see the transactions that are going on with regard to my health care, then why in the world would I care how much it costs? Why in the world would I care if there's any fraud, waste, or abuse? It doesn't affect me, right? Well, of course, we know it does. It just trickles back down and ends up in the system, and it gets embedded in other costs. But what we've got to move away from is a mentality that's causing a lot of the hospitals around the country to suffer financially, and that is, and I don't mean poor hospitals. These poor folks are going to get turned out on the street. No, but this is serious business. Our community hospitals are absolutely critical to the vitality of our communities in general, but then also to the health and well-being of the patients in your town or your county. So we've got to make sure that they're not going broke. And a lot of our hospitals around the country are in serious financial straits because the system, as it's set up today, is kind of encouraging folks to not have any of that personal accountability for their health care and to just go to the ER whenever they feel like it. Now, and again, there are instances where you should absolutely go to the ER. If you're watching this video and you're experiencing severe stroke-like symptoms, please call 911, right? I'm not discouraging people from going to the ER. What I'm discouraging is a practice that we're seeing more and more is folks using the ER as their primary care physician because it's open 24/7. There's not the same waiting, any number of reasons, and going to that ER is significantly more expensive than it is going to see your family doctor, and so what we've got to do is develop smart solutions to, even if it's a nominal charge or whatever else, to make folks just take a double take. Maybe it's $5 or $10. Maybe it's simply having any copay at all. And to make them go, am I really so sick that I need to go to the ER, or it'll be a little bit cheaper if I go see my family doctor at 8 o'clock in the morning. So those are some of the issues. Again, another great example of this is the encouragement. I think that we should encourage health savings accounts as a piece, as a part of the portfolio of health care in our country, because what that does is it allows you or your any group of people that you're affiliated with, your employer, as in the system as it is right now, to put a certain amount of money in to an account that's sheltered from a lot of the taxes that you otherwise would pay, and to devote that money toward quality health care for you and your family. Encouraging wellness visits that a lot of folks neglect, encouraging good dental care, encouraging the responsible management of a budget. That, just like a responsible family has a family household budget, we also, I think it's a great idea for us to begin to develop a mindset rather than just a gimme, 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 a responsible mindset that I saw in my grandparents' generation wonderfully. They'd come out of the Depression and they were thrifty, and it's folks who took a pot of money and they made wise decisions with that money, and that's what a health savings account does. And I think it's a good step for healthcare in our country. We're getting toward the end, so do not dismay. The fifth one is lower prescription drug costs, and specifically that is there's a lot of hocus pocus that goes on in the prescription drug industry. Surprise, surprise. One of those is there's a rebate model, so that anyone from major pharmaceutical wholesalers to pharmacy benefit managers to a lot of other healthcare organizations receive what are called rebates, and that's kind of a euphemism for kickbacks for using a particular product, which may or may not be in the best interest or the best option for an individual patient. And I want to strongly encourage, and will in Congress strongly encourage, transparency and simplicity in the pricing models for pharmaceutical drugs, because I think what we'll find is that the actual ingredient cost in most of the prescription drugs that you may take are fractions of a cent, and that the cost that you're paying relates to a lot of built-in profit, especially up in the food chain. A lot of money that goes toward marketing of those drugs. You see these glossy ads in magazines and on TV, and a lot of other wasteful spending. And we've got to rein that in. We've got to get responsible with our drug costs, and it's achievable. Next to last, we've got to control the grab on medical malpractice cases. We've got to take a serious look at the system as it stands today and make sure that doctors aren't practicing defensive medicine, and that lawyers are making a reasonable sum as they work on behalf of their clients, but not the 40% take that is so common right now. I think we can move that down, and trial lawyers will still be able to feed their families. I'm not talking about cutting necessarily the settlements to the patients. That's up for a jury of our peers to decide. But there's a responsible way to handle these medical malpractice cases that we're not doing right now. And then finally, empower the men and women on the front lines of healthcare to make the decisions. We about 20 or 30 years ago, we ceded control to from the HMOs and the insurance companies, and doctors and nurses and community pharmacists lost control and lost the ability to steer the ship of your healthcare and my healthcare. And we've got to put that steering wheel back in their hands. We've got to allow them to make the decisions. They're the ones who know us personally, and they're the ones who can work with us, who see our kids when at school when they're picking up their kids, and at the ball games on Friday nights. And we've got to make sure that those are the people making decisions about healthcare in this country, and not insurance companies. So I'll close with that now. I hope that this has been educational and beneficial to you, and I'd love to hear your responses and to engage in this conversation further. So thanks for listening.